A couple of things. Number one, Mr. Gruber, you've apologized for the intemperate, you said, insulting remarks. It's unfortunate. This whole debate about health care is so fundamentally important to this country. It's been divisive in Congress. We had a partisan vote and strongly different points of view about it. And unfortunately, the remarks you made provided clear ammunition for opponents to use that to indict the entire bill. But when you start commenting about what you expect might be a legal outcome, do you have any training as a lawyer?
No, I do not.
All right. When you comment on the quality of mind of the American people, which I think all of us here have a great deal of respect for the people we represent, you would, I take it, apologize for any insulting remarks you made?
It was inexcusable that I tried to appear smarter by insulting others.
All right. And the other thing, I listen to my colleagues here, and they talk about folks who had a bad experience with the health care bill, and some people have had good experience, some people have had bad experience, but it really is profoundly important to the American people that they have security about health care. And is it your view, I'm now going back to your area of expertise, that broadly speaking, the American health care system has been improved as a result of the passage of the Affordable Care Act?
Yes.
Just be specific as to a number of items that are now than before the Affordable Care Act was passed.
The Affordable Care Act has lowered the rate of uninsurance. About 10 million people have gained health insurance, according to the latest estimates. The Affordable Care Act has ended the fact that individuals face pre-existing conditions and the inability and the financial insecurity that comes from having to buy insurance on their own. And the Affordable Care Act has contributed to a historically slow rate of health care cost growth.
And is it also your opinion that the Affordable Care Act shares many things in common with what was called Romney Care in Massachusetts?
Yes, it is.
And you worked on the Massachusetts version with the Romney administration. Is that correct?
Yes, it is.
And I think I heard you say that the uninsured rate in Massachusetts is about 3 to 4%.
It's fallen to, but before the Affordable Care Act, it fell to about 3%. It may be lower today.
And my understanding in the passage of the Massachusetts bill is that there actually was a bipartisan vote that supported that legislation. Is that correct?
Yes.
Which we did not, that eluded us here, unfortunately, in this Congress. Now, my view is that there's a lot of things we still have to fix in our health care system. I've never had the view that any single bill is going to be the magic fix, that it has to be an ongoing process. And I'd ask you, and the cost issue on health care is the one that I think needs even more attention. But first, I'd ask you and Ms. Taven, what has happened to the growth of health care spending since the passage of the Affordable Care Act? Ms. Tavener?
I think as we discussed earlier, it's at historic lows. It's 3.7%, I believe, for 2013, which is the lowest on record since 1960. And
does that apply across the board? The person is in the health care, in the Obamacare, or on their own private or employer-sponsored health care?
Ms. Tavener, would you please put the microphone
sorry,
closer?
it is across the board.
All right. And Mr. Gruber, what would you, or Dr. Gruber, what would you cite as important elements in the Affordable Care Act that has helped slow the rate of growth in overall health care spending?
The Affordable Care Act took a number of steps in a wide variety of directions to try to slow spending. Most notably, I think, as Mr. Tavener mentioned, changes in the way that healthcare providers are reimbursed, penalties on readmissions for hospitals. We've seen an enormous reduction, which has lowered costs, and really just led to some very innovative thinking on how we can fix our broken fee-for-service medical system.
And my observation is that in Vermont, where we've had an ongoing discussion about health care and still are in the midst of that, we've got health care providers, our hospitals and our doctors, that are really focused on trying to figure out better ways to treat, to curb infections, to change the billing process, but they're on the front lines. And what are some of the things that we can do to help them be successful in providing better health care at lower cost?
I think the most important thing is to continue to learn from the ongoing experiments that are going on in our nation's healthcare system to try to understand what's working to deliver this low rate of healthcare cost spending.
Ms. Tavener?
I would agree with that. I would also say, and we have tried to do this through the Innovation Center, some upfront help in how to work with electronic health records and how to build an infrastructure that goes from fee-for-service to actually assuming risk and looking at it on a...
And accountable care organizations are part of that?
Yes.
All right, thank you. I see my time
thank-
up. Thank you.
I thank the gentleman. We now go to the gentleman